What I'm going to talk about is based on my experience in the as an advisor of the Ministry of Justice, French Ministry of Justice, for the juvenile justice system, following the riots of 2005 in some of the French suburbs. I was hired to have a sort of study, of survey, to understand better how in some French territories that have been selected for their representativeness, the services, both justice and psychiatric services, were dealing with violent adolescents. And you will see that for some reason we decided finally to call them difficult adolescents. So what I'm going to address in this presentation, I have to say before that I never thought that I would be invited to speak of this sort of data, which are more intuitive, clinical, and not at all systematized in such an audience. And so I'm out of my zone of comfort as others, but even a little more, if I may say so. So first I'm going to speak of the specificity of the relation to psychiatry in the juvenile justice system, which is different from the ordinary adult penal justice system. Second, say something about the notion of difficult adolescent and the reason why we choose this notion, this label. Third, to approach the functional psychology, to have a functional psychological approach of the violence in difficult adolescent. Fourth, to develop, to present some psychological hypotheses to grasp the role of violence in these different patterns. And finally, to conclude, some thoughts about the relation between syndrome, analogical relation at least, between syndrome and difficult adolescents, at least as a model. I have experience with juvenile delinquent, rather numerous. I've seen that there are a number of them, but I don't have a very high, I don't have experience really with people who are in our mind now, that is to say these radicalized youngs, because at the time when I was at the Ministry of Justice, which is only 5 years ago, this was not such a topic. It's extraordinary. Wait, sorry. This was not such a topic. It is extraordinary to see, of course, there was already radicalization, but it was not an issue. And even the services tended to think that it was not something to bring too much, because it would have given importance to something that wasn't that important. So this is an introduction, if you will. So what is the specificity? I think it's important to have in mind that the juvenile justice system in its relation with psychiatry is very different from the adult justice system. In the adult justice system, the diagnosographical psychiatric assessment is a central issue because it is what will help you to know, to determine if to choose to assess the responsibility of the subject. In a way, as much as there is psychiatry, as less as there is justice. It has been shown, for example, in the discussion we had for Breivik yesterday, after the presentation about Breivik. It is not the case in the juvenile justice system where, for at least two reasons, one is the fact that responsibility is always limited by essence in minors. This is in all democratic countries. And the second, it is because for the same reasons, what we call l'excuse de minorité, the minority excuse, you have on the top of your agenda of a juvenile justice system to care, to put education and care, protection at the top of the agenda of the justice system as a compensation for the excuse of minority. It's the other side of the excuse of minority, if you want. So in this system, what matters the most, it's not the psychiatric nosographical diagnosis. What matters is to understand how violence, violent acting, transgression, is taking part in the psychological functioning. It is the function of violence rather than the nosographical diagnostic of the subject, of the violent subject. In the mission I had, what we found, in effect, very easily, what was very obvious intuitively and clinically, is the fact that what the people who were the more difficult for the services were adolescents with a sort of syndrome. I never had the idea to call it syndrome before seeing the syndrome E hypothesis, but in a way it's a syndrome which is in some way comparable to that of syndrome E. It's the coexistence, you have them there, coexistence of our alternation of repetitive, callous, and emotional, violent, transgressive behaviors, often only with non-kin, whereas there are normalized empathic conduct of solidarity with peers. Very often you find that. Second, associated with this main feature, the coexistence of alternation of not compatible systems. For example, what is now very fashionable in a way is the fact that they were delinquent with antisocial values, because they are values, but they become religious with absolutely reverse type of values, very often very rigorist, even in the most elementary moral conduct and values. Third, there is associated with all that a very active rejection of all intervention, whatever discipline they are referred to, all intervention proposed to assist them, particularly when it comes to psychological understanding. And a strong tendency to use this their antisocial behavior as a mask and a way to socialize their psychological distress. Very often you have stories where there were some sociological distress that were obvious in deprived context that become completely, disappear completely, fade away completely when they come to have a very difficult type of behavior. Second point, psychiatry doesn't explain more than 10, psychiatric nosographic diagnosis doesn't explain more than 10% of this syndrome. If one does not use the concept, the notion of conduct disorder, which is a very controversial category, because it is said, and it's true in a way, I'm sure it's difficult to dispute that, it is considered a mere psychiatric labelization of a social context. In other words, it doesn't discriminate between mental delinquency and non-mental delinquency. You have studies, most of studies show that between 70% and 90% of the delinquent diagnostic, the diagnostic associated with delinquency are 90% of them are conduct disorder. All those who do not have other diagnoses. In many, many studies, you have this rate of conduct disorder. So if you don't use this, you will say that you find that it is very rare. It is only a minority of this group is explained by the diagnosis. And given the fact that psychiatric diagnostic is not very contributive and very, very ambiguous generally in these cases, given also that the fact that you will give a psychiatric diagnostic will change the way you will have the network in which they are going to be attended, we decided to approach the problem through a more neutral concept, which is difficult adolescent, to take into account the fact that what really makes them different from the other adolescent attended by the system is the fact that they are difficult to the service professional, without anticipating, if you wish, on their psychiatric status, nosographical status. So if we try to apply what matters to justice, juvenile justice system to this group, that is to say, a functional psychological approach of their violence, what we find, very obviously, but I don't have systematized numbers to give you. We find that violence is generally directed to significant others, that is to say, to others that are different, non-kin, and distorts the links with them, that is to say, violence has a an effect, an alterating effect on the relation. Second, in that sense, violence can be seen as a symptom of a pathology. I don't know if it's a good term. I think we are using it too much, but it's something that is, how to say, speaking of a pathology of the links. That is to say, there is something distorted in the links. Dysfunctional. 3, however, behind this common characteristic, which is the distortion of links, the function of this violence vary greatly between two very opposite polarities. At one pole, you find provocative violence aiming at provoking responses or a response from the significant other, creating with him a conflict of authority in which the other is present, but is present conflictually. At the other pole, you have destructive violence, where what the aim seems to be the destruction of the significant others, his disappearance, exactly the contrary as in the first case. Or it could be only disqualifying his response. What we find very, very regularly is the fact that difficult adolescents with provocative violence are much more numerous and tend to be more receptive to therapeutic, legal, or educative actions, even if at first this action seems to increase the conflict of authority with the care providers. In difficult adolescents with destructive violence, at the contrary, they are very less frequent, but they show generally paradoxical negative reaction to the same type of legal, educative, or therapeutic actions. They are not very easily reachable by that. More, as much as, that is to say, more when these interventions enhance the difference, the alterity of the care provider. That is to say, where the care provider is having a conflict that make him very present in the relation with this difficult adolescent. They are, on the contrary, this adolescent with destructive violence are more accessible to interventions that try to avoid conflict raised by the relation to the other, by focusing the adolescent attention on self-rewarding, pleasurable, creative mediation. That is to say, in something that make them forget the relation into the pleasure of functioning. It is the main point. That is to say that paradoxically, those who appear to be the less severely impaired, the provocative violent, could benefit more from the legal constraint and educative constraining or therapeutic intervention than those who seems to be the more severely impaired, that would need to have pleasurable experiences, much more than the others. It is counterintuitive, but it is very important to have that in mind, because then you will have to change the way you approach them. Contrasting with these troubled behaviors, we didn't find any systematic correlation, not only between the type of violence and the nosographical stages, but the severity of the seriousness of their transgression also. The transgression could be as severe in both, only they are more repetitive in the destructive violence than in the provocative violence, because the provocative violence tend to be soothed or decreased with the action taken, whereas the other seems very difficult to change if you don't take specific action. Furthermore, in most cases, even those with the most ruthless destructive behavior, with non-kin, establish good relation with their peer. We already said that. In the continuum between the two polarities, the prevailing type of violence varies according to the difficult adolescent level of self-esteem and the gradient of alterities, that is to say, how other is the other with whom they are related. The type of response they receive, if they don't receive the right one, if they receive the response that enhances the alterity of the other, you'll have you have a risk of having more destructive violence. So now you come to what are the hypotheses, psychological hypotheses, that have been developed in this context to grasp the role of violence in these different patterns. This is, of course, based on only speculation. It's very speculative. There is no proof at that point. But it's a good candidate, and that's why I'm bothering with you with that. It seems for me that it could be a good starting point to find candidates to explore scientifically such hypotheses. The basic idea is the fact that there is, in adolescence, and in difficult adolescence in particular, an imbalance between their capacity, their investment of their self, and the investment of the others. Prompted by the biological and sociological change, transformation related to adolescence, this imbalance would provoke in fragile adolescents, something we have to explore to define what is it. A specific psychological dysfunction of the links with two significant others. This dysfunction raises a paradoxical situation. It has been said yesterday by somebody, I don't remember who, but I think it was a question. The person who are invested because they are supposed to provide narcissistic security, they were expected to do so, are those the adolescents fear the most because of the regressive dependence they can induce in him, which means the more you are against in this situation, the more you are against somebody, the more it is a sign that you value it, him. And you see that value as a threat to your identity and narcissistic security. In this sense, violent transgression would be a way to cope with the psychological consequences of this imbalanced self-others. In provocative violence, it will be so through the conflict of authority that will allow the adolescent to provoke this conflict to mask his need of the significant others. In the conflict of authority, he gets the significant others without having to ask for it or recognize his need of him. In destructive violence, through the physical or psychological destruction of the other, when, because of his extremely low self-esteem, the difficult adolescent faces a conflict of existence, where he exists only if the other, the significant other, doesn't exist, who is not qualified, is eradicated, as I said. In this perspective, the variation of the type of violence chosen or acted by the difficult adolescent depend on the level of this imbalance, that is to say, of the level of the narcissistic insecurity of the adolescent. It's here written, higher is the adolescent narcissistic insecurity, higher is the level of his self-others imbalance, and lower the gradient of activity he can accept, he can bear. Higher is then his need to use the internal or external resources to cope with this insecurity. As a consequence, higher are both his need to invest the others and the psychological risks he takes in investing them. When the link with the other is bearable, as long as it is hidden enough behind the conflict of authority, provocative violence is the most adequate solution. But when even this solution is not bearable, is not acceptable because of the threat it represents for the narcissistic identity of the adolescent, destructive violence takes over. So now, if we come back to the, and I'm about to finish, syndrome E, what can we say in relation with juvenile delinquency model as I just tried to expose it? This question is raised in two occurrences in the paper of Itzhak. It is raised once in differential diagnosis with the idea that it shouldn't be extended to the solitary homicidal person, delinquent. But it is also raised in the last part of the paper when you propose, you suggest to use the model of youth gangs as a way to study the syndrome E hysteresis, that is to say, out of the context of what syndrome E is made for. In favor of this second perspective, we find the fact that there are many let's say speculation at least, or many ideas that find the same type of imbalance and same type of paradoxical relation to others in the terrorists, for example, those of the Paris attack of the 13th of November. Among the things that have many papers, many authors implicitly or explicitly evokes this type of imbalance. One of them is particularly explicit in this quotation by Marcel Gaucher. They shooted on what they knew, what they thought to be an aspiration for them. At the same time, they were refusing to accept this aspiration. That is helped by the fact that effectively most of the shooting took place in the place that has been very well known in Paris to be the place for pleasure of young yuppie or bobo. I don't know what's the current terminology in the States. But this second perspective raises various questions on syndrome. Some of them had been raised already by Richard Reichmann. Given that the transformation of ordinary people into pitiless perpetrators is a central characteristic in syndrome, I think it is the most central one. Is it possible, legitimate in a way, to neglect the fact that many of the current most ruthless perpetrators were not ordinary people, but former juvenile delinquents? It has been discussed, I think. If not, the problem with syndrome will not be its exceptionality, but rather its potential banality. That is to say, the fact that it could be observed in many different profiles of persons, from ordinary people to antisocial delinquents. That perspective would reinforce the interest of a dynamic approach of the problem, shifting the focus of scientific inquiries that are needed from the categorical approach of the psychological characteristic of the perpetrators to a dimensional, situationist approach of his contextualized, repetitive, pitiless violence. And this is, of course, as Reichmann said it yesterday, closest to the classical idea that destructivity is a common potential trait in all human beings. It is, as he quoted it, in the Why War Freud-Einstein correspondence, among many other papers with many other references. In my sense, this should lead us to a dimensional approach. This dimensional approach should lead us to study scientifically what we call in psychoanalysis the defense mechanisms that are actively moderating the expression of unleashed destructivity. For example, many of the data that has been shown yesterday and today could be related to something that has still to be scientifically studied, which is functional splitting. Functional splitting is something that is very common and very normal. It is a way to deal with difficult situations, stressful situations, with using your brain or your spirit or your mind, whatever you want, to forget about, to neglect part of the problem as a way to make the situation easier to deal with. And I suggest, but maybe it's ridiculous, to compare functional splitting that in finding some paradigm to study it, but I saw that you were very creative in that invention of paradigm, to compare it with the hypothesis of cognitive fracture as a complement or as a different mechanism. Comes also the other point in at what extent the differences, this typification of violence that this delinquent model suggests, is it possible to use it to go further in the understanding of this syndrome hypothesis? Among other things, I just in the previous presentation or discussion, something was said about the fact that in some cases they are not this. It's not the same type of network, neural networks that are involved in interspecific and intraspecific violence. Is it possible, for example, to consider that when you are having destructive violence, you are not only shifting the psychological function of the violence, but you are also shifting the type of mechanism, neural mechanism you are using. Something very similar to what you taught us, Alain, about the difference between sympathy and empathy from one side. But I imagine many other things could converge into that direction. Thank you very much.